The question is, can someone have hypothyroidism and still take supplements like CLA and carnitine? Because supplements and your thyroid don't always mix, and a lot of people don't understand that. So I'm going to dive deep on this today. If you're new to me, my name is Sherry. I'm certified in menopause health and hormone optimization, and I love to educate women as they transition into menopause. So let's start with CLA. This is conjugated linoleic acid. Now, this is a supplement that is often marketed for fat loss. It speeds the ability for you to do that. And, for people who have hypothyroidism, it's generally considered safe. But there are some studies that suggest CLA, when you take it with hypothyroidism, it can increase inflammation and increase insulin resistance. So it's really important to know that. Now, this doesn't happen with everyone. It usually happens just with a few select population. But the good news is that it's not going to affect your thyroid hormones, meaning it's not going to block them. But with that being said, if weight loss is one of your goals and you're looking for a supplement like this, you do want to make sure that you have someone who is following your thyroid, making sure that your thyroid hormones are optimized, because if they're low, it's going to affect your metabolism. And I'm just telling you, you can throw any supplement in your body and it's not going to be beneficial or really effective. Now, let's talk about carnitine. It's a supplement that a lot of people take to help transport fatty acids into your cells, but there's a couple caveats with this one. This is the one that can reduce your thyroid activity at the cellular level. And actually, it's been used as a supplement for people who have hyperthyroidism to block that excess thyroid function. So if you're someone who does have hypothyroidism, taking the supplement carnitine can actually worsen your symptoms and block your thyroid from doing the job that it needs to do. Now, it doesn't mean that it's going to be harmful, but it can affect you. So if you're someone who has hypothyroidism and you're looking to lose weight and you're using different supplements, here's some things that I recommend. First, you want to be working with a provider who is monitoring your thyroid panels. At a minimum, your TSH, T3, T4, your TPO, all of those things are really important to make sure that you are producing enough thyroid hormones or you're on medications that's going to keep those levels where they need to be. Now, once those levels are optimized, okay, again, once they're optimized and you have a normal thyroid function, then you can start adding different supplements that can help you. But you want to make sure that you're letting your provider know the supplements that you're taking, because you want to make sure that they're not going to interfere with making your thyroid levels worse. Now, if your thyroid is optimized, okay, and you're starting to take supplements, don't forget there's other things, because if you're still feeling tired, you're still feeling fatigued, or you're really noticing that it's been a struggle to lose the weight because your metabolism is being affected, then you want to start looking at other causes. Check out your iron levels. What is your vitamin B12 doing? Do you have high cortisol levels? Also, what is your testosterone showing? Because all of those things can affect weight loss as well. Because at the end of the day, supplementation with different things that add, like with weight loss, for instance, they can be beneficial, right? But they cannot replace optimization. You have to make sure your body's optimized in all levels, in nutrients, in vitamins, in minerals, as well as hormones, before any supplement should take that place. So I hope that helped answer your question. Of course, if you have any other questions, please drop them in the comments. And if you're liking this type of education, make sure you're signed up for our free newsletter. Just drop newsletter down in the comments and we'll get you signed up.